Mr. President, the American people understand, whether they are Democrats, Republicans, or independents, that our health care system is broken, it is dysfunctional, it is failing. We spend almost twice as much per person on health care, an unsustainable $13,000 for every man, woman, and child, than any other country on earth, and yet the results of all of that spending are abysmal. While the insurance companies and the drug companies make hundreds of billions of dollars in profit, we have 85 million Americans who are uninsured or underinsured, and over 60,000 people who die every single year because they can't get to a doctor when they need to. In this country, despite our huge expenditures, we don't have enough doctors, nurses, dentists, pharmacists, or mental health specialists. And our life expectancy is far lower than most other countries, especially for working class and lower income Americans. Mr. President, in my view, and I think it's the view of most Americans, health care is a human right, not a privilege. And we need major reforms to our current system so that every man, woman, and child in this country gets the quality health care they need, regardless of their financial status. The responsibility for reforming our broken health care system rests with the administration, and it rests with many agencies of government, including HHS, CMS, the FDA, and the National Institute of Health, NIH, which plays a very important role in the development of new prescription drugs. Mr. President, while the 10 largest drug companies made over $112 billion in profits last year, and while they pay their CEOs exorbitant compensation packages, 1 out of 4 Americans cannot afford to pay for the medicine they need, and thousands of families face financial ruin as they pay outrageously high prices for the prescription drugs that keep them alive. Let's think about that for just 1 second. Millions of people in this country every year get sick. They go to the doctor, and the doctor writes out a prescription. And yet, because of the exorbitant price of prescription drugs in America, 1 out of 4 of those people cannot afford to fill that prescription. So what happens to those people? Well, they get sicker. Maybe they end up in an emergency room. Maybe they end up in a hospital. Maybe they die. How crazy is it that in the richest country in the history of the world, 25% of our people cannot afford to fill the prescriptions their doctors prescribe? But it is not just the high cost of prescription drugs that impact individuals. In the largest hospital in my state of Vermont, and I don't think it's terribly different elsewhere, the high cost of prescription drugs account for 20% of the overall budget of that hospital, and that drives insurance policies up. What we pay in the hospital impacts greatly the prices we pay for insurance. In other words, Mr. President, the outrageously high cost of prescription drugs in America is a crisis situation that must be addressed. It impacts everybody. Adding insult to injury, not only has the federal government not effectively regulated the price of prescription drugs, but the taxpayers of this country have, over the years, provided hundreds of billions of dollars in research and development into new prescription drugs that have provided enormous financial benefits to some of the most profitable drug companies in America. For example, in America today, the median cost of new cancer drugs has gone up by more than 300% over the past decade, even though 85% of the initial foundational cancer research is funded by U.S. taxpayers. In June, the Health, Education, Labor, Pension Committee, which I chair, released a report that found that the average price of new treatments that NIH scientists helped develop over the past 20 years is over $111,000. In other words, we are spending a fortune developing new drugs, but our people cannot afford the treatments that they pay for. In virtually every case, American taxpayers are paying far more than people in other countries for the exact same medicine that the NIH helped to develop. Now, that may make sense to somebody. It does not make sense to me. And here are just a few examples from the report. Astellas and Pfizer charge Americans with prostate cancer over $165,000 for Xtandi, while the exact same drug can be purchased in Japan for just $20,000. Guess who developed that drug? American taxpayers. Johnson & Johnson charges Americans with HIV $56,000 for Semtuza, while the exact same treatment can be purchased in the UK for just $10,000. Guess who developed that treatment? American taxpayers. Millennium Pharmaceuticals charges Americans with cancer $54,000 for Velcade, while the exact same drug can be purchased in France for just $11,000. Guess who did the research and paid for that drug? The NIH and American taxpayers. In other words, here is the insane situation. The American taxpayers fund the research for these drugs, but they can't afford the product that they helped create. Does anybody really think that makes sense? If American taxpayers help develop a drug, we should be paying the lowest prices in the world for that product, not the highest. Mr. President, that has got to change. No prescription drug, no matter how effective and life-saving it may be, is worth anything to the patient who cannot afford it. In my view, at this crisis moment for American health care, we need an NIH director who is prepared to take on the greed of the pharmaceutical industry and use every tool at their disposal to substantially lower the extraordinarily high cost of medicine in this country. The 1,800 well-paid lobbyists from the pharmaceutical industry here in D.C., it's almost 4 lobbyists for every member of Congress, may not like it, but that is precisely what the American people want, and it is what they need. The status quo is not working. We need fundamental changes in the way that the NIH addresses the crisis of high prescription drug costs. Dr. Monica Bertagnolli is an intelligent and caring person, but she has not convinced me that she is prepared to take on the greed and power of the drug companies and the healthcare industry in general. Nor is she prepared, in my view, to fight for the transformative changes the NIH needs at this critical moment. And that is why I will be voting no on her confirmation. And with that, Mr. President, I yield the floor.